I'm Dr. Danielle Todaro. I'm a licensed psychologist with Fort Bend County Behavioral Health Services, and I'm going to be presenting today along with Edward Odom. He is a doctoral student from the University of Houston Clear Lake that has been interning with behavioral health services for almost the past year. And we are going to be discussing self-care and compassion fatigue today. So, what is compassion fatigue? So, really, this is understood as a state of chronic physical and mental distress and exhaustion. People who experience compassion fatigue often describe having this negative shift in their worldview, how they see things, and it can even get to the point where they start to have preoccupation about others, caring for others, maybe the illness or medical conditions of others. Because as we're going to talk about in a minute, compassion fatigue really traditionally has been talked about and observed in helping professions, but of course, with the pandemic, everyone has had to take on roles in terms of increased caretaking and providing care for others, so it can be more widely applied. But traditionally, we think about it in terms of caring, and so focusing on illness is something that can be a sign of some compassion fatigue. And really, when folks experience this, they often can describe it as experiencing stress or even burnout. So really feeling just very overwhelmed about these caretaking tasks that they have. And this compassion fatigue can affect their ability to be effective in their jobs, especially if somebody is in a helping profession, can hurt their ability to relate with friends and loved ones. And again, this can happen whether you are in a job or a career field where you are focused on helping others, but can also be seen in folks who have to simply just take on a lot of caretaking responsibilities, even outside of their work. And really, if you think about it, in most professions, we're taking care of something. Maybe it's not always people or patients directly, but there's always needs that need to be met, whether it's clients or customers, or the community at large. And so this is so applicable to a wide variety of individuals. So I've talked about this a little bit already, but who can experience compassion fatigue? So it can affect a wide variety of professions and really individuals at large. Traditionally and pre-pandemic, we really tended to hear about compassion fatigue among professionals who regularly work in some kind of helping or healing capacity. So we think of our medical personnel, doctors, nurses, therapists in a hospital setting, in a medical setting, mental health professionals, and of course our first responders, so law enforcement, firefighters, EMS, all professions where this was commonplace because the purpose of all of these professions is to help and care for others. However, we can expand this to caregivers and parents. Especially during the COVID-19 pandemic, folks have had to take on additional caretaking duties. Parents who once were able to send their kids to school or daycares for a period of time, they were taking on those childcare duties, those educational duties. Folks may also have parents or relatives that they may care for that might be older and live in a home with them, might care for a loved one that has a medical condition. And so these compounding experiences of having to take care of folks, whether it's professionally, personally, or a combination of the two, really put somebody at risk for experiencing some form of compassion fatigue or burnout. So when we think about compassion fatigue and we think about signs, it's important to keep in mind that this is not a diagnosis. This is not a mental health condition that can be diagnosed by a mental health provider. So we like to talk about these as signs of compassion fatigue, not necessarily symptoms, although some of the things that we will talk about are connected with some mental health disorders. So it's important that we keep these things in mind and keep an eye out for them. So we have 4 areas really that we're going to be looking at in terms of signs of potential burnout or compassion fatigue. So the first 2 I'm going to talk about are the workplace and then cognitive signs. So again, since we traditionally see compassion fatigue in helper professions, we talk about, of course, how this burnout can affect our work. But again, this is applicable to anybody in any field or any profession. So if we're experiencing some compassion fatigue, we may have affected judgment or clarity of thinking on the job. This may also impact decision making, especially in critical situations. And if we're going to apply this specifically to people who are working in very high stress kind of crisis situations, again, ER medical professionals, our first responders, this impact here could be very significant if folks are not able to make, moment to moment critical decisions in crisis or, very difficult situations where they have to make decisions. So compassion fatigue can also cause just overall ineffective job performance. Folks may start to feel that they're not doing their job as well as they used to, or that nothing that they can do is helping anymore. I think a good example, from the county perspective, are folks working in our social services department who, may experience compassion fatigue from providing so much help and support to folks, especially in this time of the pandemic where needs have increased. And if somebody starts to feel burnout, they may feel like they're not doing their best. They're not helping as many people as they can. They're not giving all they can to providing support to folks. So that's just one example of that. Low professional pride. So you maybe once really felt a sense of pride, accomplishment from your job, and now because of burnout, because of compassion fatigue, you're not experiencing that anymore. Poor job satisfaction is another piece, and Edward will talk about this later in the presentation about fostering compassion satisfaction as opposed to fatigue. If we can really feel that sense of pride, feel that satisfaction, and feel gratified from helping people, whether again it's in our employment or just in our personal lives, that can kind of help protect and buffer a little bit from experiencing compassion fatigue. And then you may experience skepticism towards the public or the agency or the company that you work for. That can even bleed over into, feeling skeptical about your family, or even resentful if you're having to take on all these additional caretaking duties and might feel overwhelmed. And then we move over to the cognitive signs of compassion fatigue. So lack of concentration, that's probably the biggest sign that we have of some cognitive, which is basically just talking about kind of how we think, how we plan, how we make decisions. We tend to see folks really struggle with making decisions and concentrating when they're experiencing a lot of burnout. They can experience intrusive thoughts. So again, some of these from this workplace column might start creeping into their thinking. I'm not making a difference. I'm not doing as much as I could. Nothing I can do is helping. And these, of course, can interfere with their day-to-day kind of functioning. They may blame themselves or others, especially if we have folks that are in helper professions, right? Those individuals tend to go into those fields, or even parents. We choose to be parents because we want to help people, we want to care for young children. And if we're starting to feel like we can't, we're so burnt out, we may blame ourselves. Well, must be something wrong with me, I can't handle this. Or maybe blame others. I'm having too much responsibility put on my plate or things like that. We can have other maladaptive, which is just basically a fancy clinical term for negative, other negative thoughts. Again, feeling like we're not doing a good job, we're not doing enough, our hard work is going unnoticed or unappreciated. And then a much more serious sign of some cognitive disturbances, dissociation. So basically that's feeling very disconnected. Sometimes this is used to describe kind of like an out of body experience. So we don't really feel very connected with who we are. Maybe kind of feel like a robot going through the motions or things like that. The next two areas are the emotional and behavioral and physical signs. So emotional, these are some signs that perhaps others around us, if we're experiencing compassion fatigue, others around us may start to see some of these things, and not necessarily all of them. But when we're very in tune with someone, when we're very close to someone, we notice when there's shifts in their mood and how they're feeling and reacting. So things like anger and irritability. If that's not normally your temperament and you start to feel angrier, you start to feel more irritable, more easily set off by small things, that could be a sign that you may be experiencing compassion fatigue, or somebody around you may be experiencing that. Depressive symptoms, that's obviously a much more serious sign that we want to keep in mind. But if somebody is generally in a very positive mood and all of a sudden you're starting to see some signs of sadness, they may express, or you may feel feelings of guilt, helplessness, or hopelessness, loneliness. Even if you're on a team, in a work environment, or in a busy family, if you're starting to feel very lonely. If you're experiencing low self-esteem, again, kind of tying some of that back to maybe some of those workplace issues, you're feeling like you're not doing what you should be doing. You might feel feelings of shame and then tension. You might feel just constantly tense or maybe anxious about things. Then the behavioral and the physical. So these are really the signs that if we are experiencing compassion fatigue, these are probably the first ones we're going to notice. We're obviously most in tune with our bodies and how we feel on a day-to-day basis. And so these may be things that we notice right off the bat. They may also be things that others around us, especially spouses or partners who live with us and know our habits, they may also point these out as some changes that they may see. So disrupted sleep. So whether that means not sleeping enough because you're having trouble falling asleep, or you're waking up multiple times at night. This could also be sleeping too much, just feeling like you can't get out of bed, feeling like you still need a lot of rest. So that moves into the second one on this list, fatigue. So maybe you are getting enough sleep, you are getting enough rest at night, but you're still feeling very tired, very worn down. That may be a potential sign of some burnout. Migraines or headaches, especially if these are not things that you experience on a regular basis. You could add to that too gastrointestinal issues if you don't normally have a lot of stomach problems, but all of a sudden you're starting to have more frequent stomach issues. That may also be a sign of some burnout. You're having personal relationship issues, so you're having more tensions with friends and family and loved ones, more discord with folks that you're close with in your life. Physiological hypervigilance, which basically that's just a clinical term to say you're kind of on edge, you're kind of tense or keyed up. You could say that it's some feelings of anxiety. Again, if you're not normally an anxious person, if you're normally pretty calm and collected, this could be a tip-off that you may be experiencing a little bit of burnout or compassion fatigue. Social isolation. So that goes kind of hand in hand with some of the depressive symptoms that we talked about on the emotional side. If you are starting to isolate yourself more, whether at home or in your workplace environment, not wanting to be around others, that could be a sign. And then more seriously, more significantly, substance abuse. So that could mean seeing somebody's consumption of alcohol, for example, start to increase more than normal. Perhaps they are on a prescription medication and now they're taking more of that prescription medication than usual, especially if it's some kind of pain medication or something like that. Or folks may even start to use illicit or illegal substances. So that's obviously a red flag and a warning sign that folks definitely want to take seriously. And the thing is that with compassion fatigue, you can experience some symptoms or some signs in one column and not others. You could experience a little bit from each area. Everybody is going to be different. And when this starts to become a problem is when any of these things that you're feeling or experiencing are starting to interrupt your daily functioning and your ability to maintain and manage your day-to-day tasks. They're interrupting your relationships with others. They're interrupting your work, like we saw on the last slide. That's when we know that the burnout, that this compassion fatigue from expending so much energy in caring for others is really having a detrimental effect on ourselves. So there are some tools that are available through an organization called the Compassion Fatigue Project, and their website will be shown a little bit later on. But both of these self-assessment tools can be found on that website, and they're really two great tools to use to kind of just really see on paper, kind of in black and white, the level of stress or the stressful experiences that you're going through on the life stress test. And then the second one, it focuses a little bit more professionally for those in helping professions to kind of measure how you're feeling and as a check-in of where you're at. So the life stress test, this is what it looks like. And it says that it's for caregivers, but again, we've established that caregivers can be a broad range of different types of individuals in professional settings and in personal settings. So what this test is basically just a list of very stressful life activities that are valued with different point values, and you are to read through it and mark whichever events you've experienced in the past 12 to 24 months. And so, of course, over the course of this pandemic, all of us have gone through that stressful experience. I don't know anyone who would say that the pandemic has not been stressful. So just starting there, we all have at least one very stressful event within this time period. But then as you read through the list and mark points, you'll add them up and then use this little scale down here on the second page to kind of assess the level of stress that you're experiencing from low, medium to high. And really what this is going to help tell you is your susceptibility to stress-related illness. So compassion fatigue could be considered a stress-related illness, just in terms of the stress of caring for others. Obviously, things like anxiety, depression, or mental health conditions that also may have some connection to stress. So of course, these are things that we want to be mindful of. And this is just a good way to kind of sit back and say, wow, I have experienced a lot of stress or I haven't, just to give some broad perspective about the things that perhaps you've been through over the course of the past year to 2 years. And then hopefully once you identify where you're at, you can implement some self-care measures, which Edward is going to talk about in a few minutes, to help manage some of that stress. The other tool that's on here is the professional quality of life scale. So this scale is more geared towards those in helping professions. But again, that could be very broadly and widely applied. That doesn't necessarily mean you have to be some kind of healthcare provider or first responder, working in many different settings. You could be considered a helping profession. And so this scale, again, gives you some feelings, situations, thoughts to assess and rate on a scale of 1 to 5. And then again, you're going to add your score up and match it to what it says on the second page here in terms of these 3 different areas that the test is trying to assess for. So I'll start with the middle one on this second page is burnout. So really trying to assess the amount of compassion fatigue you are experiencing at the moment. The next one on there is secondary traumatic stress. So this is something that tends to be more typically seen in professions like law enforcement, or EMS, medical professionals, mental health professionals, where we secondarily get exposure to the trauma that individuals have been through, or maybe even witnessing it firsthand. For example, if you're an EMS professional and you're working some kind of accident or something like that. And that trauma that maybe we didn't directly experience, but indirectly experience, will start to affect us over time. So it'll assess that. And then finally, it will assess your compassion satisfaction, which Edward is going to talk about later on in the second half of this presentation. And so that, again, is measuring how much satisfaction are we getting from being compassionate, providing care to others. And that can be a good protection measure if that score is high, if we are getting a lot of satisfaction from it. Then that can kind of help protect us a little bit from getting burnt out and feeling the effects of compassion fatigue. In behavioral health services, we completed this measure. I want to say it was kind of when we were deeper in the pandemic. So sometime maybe mid to late last year as a department, we did this. And this is a great tool to use if you're a manager, in whatever type of work environment, to really kind of check in and assess. And we were actually surprised by the results that we got. Most of us did not score as high on the burnout as we thought we would, and we all felt very burnt out because we were obviously doing our normal work duties, but then also a lot of additional stuff that was COVID related. And a lot of us had higher compassion satisfaction scores than we thought that we would have had at that moment, based on the pandemic and kind of how we were feeling at the time. So these are some great tools. Again, this one is great in a work setting for managers and supervisors to maybe get a good assessment of how their staff are feeling and doing at the moment. So in terms of workplaces, the Compassion Fatigue Awareness Project kind of emphasizes creating a healthy workplace and develop these 10 laws governing healthy caregiving. But again, this can be applied to multiple different work environments and also in home and personal environments as well. So I'm just going to go through a couple of these. We've talked about a few of them already. So of course, the first one is sustaining your compassion. Again, if you can still feel a sense of fulfillment from helping others and caring for others, that's going to help be a protective measure for you. Practicing sustainable self-care. This says daily. Like I mentioned, Edward is going to talk more about self-care in a moment. And self-care can sometimes folks feel like this is another chore or task, but really it's an important piece to implement, even if it's one thing you do a day to take care of yourself. Building a support system or fostering a support system, especially now as we're moving through the pandemic and can have more contact with folks, depending on different variables to ensure our safety. That's an important one. Creating a work-life balance. That's not always easy, but very important in terms of maintaining your well-being and kind of avoiding burnout. Using humor, learning to let it go, some things just out of our control. Acknowledging your successes. So again, even when you feel burnt out or feel like things are, there's a lot on your plate that you're trying to manage in terms of your time and caregiving, acknowledging that you've done a good job or done something well is very helpful, and it can go a long way. And then, of course, number 10, elevating your levels of compassion and satisfaction. So number 1 is sustaining it and then making sure that it's there. And then number 10, elevate it. What can we do to increase that and build that even further? And so with that, I'm going to turn the presentation over to Edward, who is going to talk about some ways to implement self-care and how to offset some of the effects of compassion fatigue.
Thank you, Dr. Todaro. So, like we said at the beginning, my name is Edward Odom. I'm a doctoral student at University of Houston Clear Lake, currently under the supervision of Doctors Danielle Todaro, who we just heard from, and Dr. Tanya Martin here at Fort Bend County Behavioral Health Services. So, Dr. Todaro did a wonderful job at kind of introducing basically who's susceptible to compassion fatigue and kind of what is it and what it consists of. So now, what can we do to combat that? And so self-care is really, really important. I think, even without compassion fatigue, self-care is going to pretty much optimize your mental and physical health. So what I mean by self-care is, and this pie chart kind of emphasizes the equal level of importance of each of these basically components of self-care. So going to start with, social and attachment. So we saw earlier that social isolation can be, one of those, red light indicators for depression or, compassion fatigue or in other mental health conditions. So basically what we're taught in school is the first kind of line treatment for preventing depression and treating it is to basically do like a positive opposite and activate behaviors. So getting out and being social, focusing efforts on the people that we're close to, also crafting or creating a positive support circle. So people who bolster your self-esteem, who are good listeners, identifying people like that we can be close to. And kind of, if we need to vent, if we need to process something emotionally with somebody, having somebody that we know we can count on is very important. So physical health, I'm going to go kind of counterclockwise here. Physical health, doing things like exercising regularly, cardio 3 times a week for 30 minutes each time, eating nutritious foods, drinking plenty of water. So those are kind of some of the things that you can do to address your physical health. Doing meaningful work. I think, this presentation kind of assumes that like we are in professions that we are helping people, and there's a reason that we're in these professions because we find it meaningful. So focusing on that, but also doing meaningful work outside of our occupation, such as volunteering for a charitable organization whose mission we identify with and really support. So, Habitat for Humanity, the Houston Food Bank, feeding those without homes, things like that. Spiritual practices. So this really emphasizes kind of slowing down, taking a step back, and examining kind of what's going on with ourselves. So really, for any of this to work, we have to be able to recognize within ourselves that something's going on, that we may actually be experiencing this compassion fatigue, and with the symptoms being like tendency to blame others, blame self, like it's important that we get an objective look at that so we can take positive action. So one way of kind of slowing down and really taking an examination of ourselves is practicing mindfulness. So there's a ton of mindfulness meditations on the internet. We're going to talk a little bit more about that here in a few slides. But also other spiritual practices include, going to church, getting involved with that community if that's something that you participate in, regular prayer, things of that nature, getting out in nature even. So, getting out for a walk, going on a hike, things like that. And so really all of those kind of things contribute very much to our emotional and mental health. And it's important that we monitor our moods, monitor how we are feeling and how, we're acting towards others and ourselves. So, yeah, so emotional and mental health are very, very important too. So, gonna go to the next slide, Dr. Todaro. Just some more tips for overcoming compassion fatigue I touched on a little bit, but taking care of those basic needs. So in terms of like our hierarchy of needs, eating well, staying hydrated, sleep, exercise, we need to have all of those kind of as our foundation to kind of work on the other things too. We have to have that kind of balance. Engaging in activities to help manage stress. So, there's exercise, there's volunteering, there's, playing with your kids, but it's going to be unique to the individual. So again, this kind of emphasizes the importance of taking a step back and looking at what exactly kind of makes me tick, what causes stress that I can minimize or realistically minimize, and what helps me to minimize stress. Also, keeping daily routines as consistent as possible. This kind of gets into the biology of things. Our circadian rhythms, if they get disrupted, if we, sleep in till 3 p.m. one day and then get up at 6 a.m. the next day, we eat meals at different times. That's going to kind of, muddy the waters a little bit, and it has a direct impact on our mood. Staying connected with others. I think I touched on this before, but again, developing a healthy support system. I really can't emphasize that enough, because sometimes other people are our eyes and ears. So if something's going on within us that we don't really necessarily recognize, having a trusted other, coming and telling us, hey, I've noticed, X, Y, and Z. I'm kind of concerned about you. What's going on? That kind of thing. So taking a self-compassion break. There's some wonderful work by Dr. Kristen Neff. She has a whole website devoted to self-compassion work. Basically acknowledging like, hey, I'm having a difficult time, or I need to be kind to myself in this moment. It's basically the principle, the overarching principle is to treat yourself as you would like a friend or a close loved one, and kind of, flipping that perspective back on yourself. So all of that compassion work that we've been doing and, that's been contributing to our compassion fatigue, we need to turn that inward to kind of help bolster that up so we can, practice more compassion for others. And research has shown that those who are more self-compassionate tends to bleed over into, compassion for others. Setting boundaries for yourself. I know I struggle with this one. Pretty much if somebody asks me to do something, I'm pretty much willing to do it. But again, taking a step back, looking at, schedules and things like, can I really realistically and effectively, participate in something, or, work-related duties, social obligations, things like that. And I feel like this is helpful for anybody, especially if you're really struggling with this and it's a consistent theme. There may be something deeper going on. So seeking out counseling, having a professional be able to assist you with kind of identifying these red light areas, and maybe even crafting a whole plan for you to kind of execute to help overcome compassion fatigue or depression or whatever. Dr. Thank you. And like a useful tool for I know I need constant reminders to kind of take care of myself, because I'm just kind of on go all the time. But there is a useful tool that you can find on this compassionfatigue.org website. That is, it's just a little card, and it kind of emphasizes all of those self-care activities that I just talked about. So getting enough sleep, getting enough to eat, vary the work that you do, light exercise, do something pleasurable or something, something that you feel a sense of mastery upon completion, working on hobbies and things like that. Focusing on what you did well as opposed to focusing on the mistakes that you've made. Learning from those mistakes. Again, emphasizing the humor and meditation and relaxation and supporting a colleague. So this is something that you can print out and just plaster all over everywhere, so you can kind of remind yourself to say, hey, I need to take care of me too. Like, I'm taking care of everybody else, but I kind of need, you can't really pour from an empty cup. So focusing your empathy, this is another really useful strategy, and it really emphasizes kind of having two modes in your life. So when you come to work, we turn on work mode and kind of compartmentalize those other areas of our life that may be contributing to our stress, but focusing our empathy is kind of being able to focus on the job at hand. So turning that on when you come to work, turning it off at the end of the day, so as to not take that kind of stuff home with you. And it takes it adds some specific tips. So make it a conscious process. Talk to yourself as you do it. I'm switching on to work mode. Say that to yourself. Use images that make you feel safe and protected when doing so. So, visualize, you're this helping person, you visualize your clients and visualize helping them. Whereas, turning to off work mode or non-work mode, visualize your family, your friends, your dog, whatever it helps you kind of feel more safe and secure in whatever mode that you're in. Developing rituals, anything to kind of signify, I'm doing this, like developing any kind of ritual that can help you switch from start and stop work. And so, and then breathing slowly and deeply to calm yourself when doing a tough job. So these are all really helpful strategies to kind of focus your empathy. And again, if we don't, let me speak for myself. If I don't participate in these self-care activities, I will be pouring eventually from an empty cup. And that will definitely impact my ability to be the most effective therapist or evaluator that I can be. And then it will impact the level of satisfaction I get from being a compassionate provider. So this compassion satisfaction is an internal feeling of increased motivation and satisfaction derived from helping those who suffer. And I think anybody who probably works in the helping profession can know what this kind of compassion satisfaction feels like. I know that I feel very invigorated and just ready to help everybody at some, whenever I'm feeling this kind of this particular satisfaction. And it's a source of internal strength, and it can offset the burnout that we've emphasized here. Next slide. So we are going to do a mindfulness exercise now. So it's you can find this on YouTube. So this is going to kind of help us. So mindfulness is defined as paying attention on purpose without judgment. So kind of taking that step back that I talked about and looking at how we're feeling, what we're thinking, without that layer of judgment.
Have you been feeling anxious lately? If so, I have something for you. My name is Dr. Christiane Wolf from Inside LA, and this is a short mindfulness practice. So mindfulness teaches us that we are actually always in the present moment. The body is in the present moment, the mind is not. So where's the mind? The mind is either in the past, rehashing, or in the future, rehearsing. And right now, it's a lot in the future rehearsing. And that makes us anxious right now. It makes the body anxious right now. So let's practice with that. So I'm inviting you to finding a comfortable posture. You can be wherever you already are. Closing your eyes for a moment, if that feels okay. And just feeling your feet on the ground. feeling how the chair supports you, or if you're standing, how you're just supported in that posture. And then feeling the breath. So noticing where you feel your breath, making the breath a little bit longer and deeper. All the way in, all the way out. If you like, you can emphasize the exhalation just a little bit more. And if you notice that the attention runs away into the future, just bring it back to right now, right here. And if you're feeling anxious, just seeing if you can allow this for right now, just right now for this moment, noticing where you feel it, maybe in the chest or the belly. And then using the breath, imagining you can breathe into this anxiety, into these sensations of anxiety, or breathing some space around it. Allowing this to be here as best as you can, holding it with kindness. And then asking yourself, am I okay right now? If I don't let myself run into the future, if I'm really here in this moment, am I okay right now? And the answer almost always is yes, you are. So here you are. Thank you.
So now we are just going to go over a few resources. So mindfulness resources. I did neglect to say that a key piece of mindfulness is paying attention to the present moment on purpose without judgment, and kind of using that breath as like an anchor to the present moment when our mind kind of starts to wander a little bit. So here's some websites: mindful.org, headspace.com. They actually have an app that you can use, and it has a ton of free meditations. You can also pay for extra stuff. John Kabat-Zinn, he's kind of like the MVP in terms of mindfulness. He really pioneered the mindfulness-based stress reduction therapy. So anything that he does on YouTube is going to be kind of like, that's a stamp of approval. Meditation apps, some other ones are Insight Timer, Smiling Mind, Stop, Breathe, and Think, UCLA Mindful. I'm blanking on any other ones, but I've definitely used those apps, and they're very helpful. Again, and here's the Compassion Fatigue Awareness Project. It goes really in depth as to what compassion fatigue is, what it kind of stems from sometimes, and how it's kind of in the family of trauma and stressor related disorders, although it's not itself an actual disorder. Here's some other resources. So Deer Oaks Employee Assistance Program, Texans Recovering Together, that was made for, it's a resource for people who are, who are struggling with like disasters such as COVID and hurricanes. Here's actually our website, Fort Bend County Behavioral Health Services, and several more. These are wonderful resources in case you're going through a crisis. So the National Suicide Prevention Lifeline, NAMI has a lot of, it's the National Association on Mental Illness. They have a lot of resources on their website to kind of connect you with any kind of mental health treatment that you may need. So Dr. Todaro, I don't know if you have anything to add to that.
No, I would just say that if you, kind of like Edward already mentioned, if you have listened to this presentation and, see some signs that get you thinking, okay, maybe I'm experiencing some compassion fatigue, or a loved one is experiencing some compassion fatigue, the self-care tips and tricks that Edward talked about really can help. Sometimes it seems like it's, common sense, but when we really stop and look at it, most of us, including mental health professionals, are not great about taking care of ourselves. And as Edward mentioned, we really can't be effective in caring for others, whether it's in our jobs or in our personal lives, if we're not taking care of ourselves. And I think it's equally as important to reach out to those around us that we see, whether it's coworker, friend, loved one, if we see that they seem to be struggling. And I know sometimes people feel a little uncomfortable maybe about talking about mental health with somebody in their life. But I think if you approach a discussion from, hey, are you doing anything to take care of yourself? And taking it from a self-care perspective, you may find out that those in your lives that you're concerned about are not doing any of those even very basic things to take care of themselves. So it's a really great place to start a discussion. And then, of course, if there are concerns beyond that, again, like Edward mentioned, making sure that you're reaching out to some of the resources on here. Behavioral health services is always available to connect folks to resources in their community, or specific resources if you're needing something. We didn't talk much about kids and young people here, but we're able to connect folks to any resources that we think might be beneficial if you are struggling. These are tough times, and even though we're hopefully moving towards the tail end of the pandemic, I know our presentation on Monday is going to be talking about fears and anxieties about that process specifically. And I know, things are changing every day in terms of the pandemic, and, things for work, school, our kids. So this is a constant state of kind of flux that we're having to manage. And so maybe we made it through the pandemic okay, but then post-pandemic, we are starting to feel a little bit of that burnout, or things are catching up to us. So we just want to make sure that folks are mindful of that and aware of that, and can reach out to behavioral health services if they need some assistance getting connected. So that's all we have. I don't know if there's any questions coming through on the chat, or if Dr. Almeida has anything else she wants to add. I apologize for the technical issues on my end. I don't know what was going on, so I'm sorry for that. Hopefully folks could hear everything okay. So Dr. Almeida, I don't know if you had anything else, or if there were questions to be addressed.
No, thank you. We can blame it on the weather, all the technical issues. So, I mean, I had loss of power and water, and I know you did too. So that could definitely be contributing to this. So I think there were several really important things that, you both discussed, and sometimes in Dr. Todaro, you alluded to this, sometimes we use all these technical terms, hypervigilance and all this, and it's kind of like, but you talked about it, this feeling like you're on edge, how we lose perspective of things. So things that normally, we can react to, all of a sudden they have such an exaggerated impact. I mean, it really, we lose perspective, whether that's because we are more hypervigilant, just because we're more tired because of this compounded stress. And with that, it's like this overreacting. And I think we have to be really aware of that we're overreacting to things, either in the workplace, personal life, that normally we would be able to manage. So kind of on edge, losing perspective, overreacting. One of the things that I wanted to talk about is like this self-care. We use that term a lot. Something that we've realized during this pandemic is that self-care requires more energy and more of an intentional focus. So it's like, on top of everything else, we have to put more effort into self-care. And that's something that, a lot of colleagues and, just in talking to others, it's like, oh, we really have to make this a priority. And I think we also have to have some kindness with ourselves and not being so hard and judgmental about ourselves that, maybe we're not exercising every day. Maybe all we can do is 5 minutes a day. Again, recognizing that in part because of what we've all experienced, most things take a lot more effort, including self-care. So I really just wanted to bring those things and maybe, a little bit, just really reemphasize that again, which both of you talked about. And Dr. Todaro, you alluded to this in terms of, getting back to this normalcy. And sometimes it's like, oh, okay, we're very fortunate, things, and especially in Fort Bend County, things are looking pretty good. Yet why are we feeling this exhaustion, or why are we still feeling some of this anxiety? We have to recognize and remember that often the impact of a traumatic event is not seen right away, but actually seen 6 months, a year later. So again, maybe we were actually better able to cope with things when we were in that crisis mode of having to take care of things. We're all very good at that, responding. And maybe we could actually be feeling some of that PTSD, or just whatever that looks like for you. But, trying to understand better what you're going through, and in putting it in perspective, building those coping strategies that have worked for you in the past, coming up with new ones, and again, recognizing that there's been a lot of anxiety, there's been a lot of unknowns, and, if you need to seek professional help to talk to somebody, do it. There's resources out there. That's the only other thing I wanted to mention is, as Dr. Todaro mentioned, referenced, we're available to, you can call our offices and we can provide just, some resources, link you to services. But also, if you want us to come out and talk to your organization or department within or without or outside of the county about compassion fatigue, we're also willing to do that and try to work out some schedules where we could do that for you. So we're here to assist, and I think that's all that I have. These are great resources. Please use them, and that's all that I have. I don't see any questions. I don't know if there's anything coming in from Facebook.
Dr. Almeida, there was one question that I see on the chat. It says,
Okay.
how do you know if you are burned out and just keep going?
So how do you, do you want me to answer that? You want to try to answer that?
I will say, I think in terms of burnout, obviously that's what, compassion fatigue can be described as. It's a sense of burnout. And, going back to some of those signs that we talked about earlier, if you're starting to experience, those emotional signs, behavioral and physical signs, changes in your thinking, if the burnout is specifically related to, being in a helping profession, your workplace, or if it's related to, being burned out from duties in your personal life, if it's impacting, your functioning in any kind of way, right? It's impacting your ability to get your work done like you used to. It's impacting your ability to manage, things in your home or in your personal life like you used to be able to. If it's interfering with that in any way, that could definitely be a sign that there's burnout, right? That the culmination of all of these things, right, and all of these things that you're feeling and experiencing are now impacting your day-to-day life. That could be, at least from my perspective, I think, a sign of burnout. And I mean, some people keep going through the burnout. However, you may be putting yourself at risk for then really crashing, really being unable to manage those things in your life, potentially, having things escalate further into more concerning mental health conditions. So if you think that that's where you're going, then the recommendation would be, let's try to intervene and implement any of those kind of self-care things that we talked about, even if it's one thing, right? Even if it's just connecting with a friend and having, a FaceTime conversation, or going out to the park or something like that. It doesn't have to be this large shift like Dr. Almeida was talking about, where we are thinking now we're causing more stress just thinking about what we have to do to relieve our stress. But if it's one or two changes, things that we can, introduce into our day, they could be extraordinarily helpful in kind of curbing some of that burnout.
Now, I just wanted to add to that, because I think we talked about this briefly in one of the other seminars, maybe it was the tips for parents. These mini escapes, because as you mentioned, sometimes like, okay, planning a vacation or planning something else or a major event that not only, takes a lot of time, but it takes a lot of planning and coordination and cost, can add to more stress, especially during this pandemic. So these mini escapes, whatever that is for you, it could be a 5-minute, 10-minute escape, or it could be a day off. In Fort Bend County, we encourage mental health days. We recognize that those are really important. So, one of the things is, like, if you are experiencing that burnout, trying those mini escapes and see if that helps you feel better. I mean, and the things about feeling better, it's like, well, think about it. Do you sleep better? Are you less reactive? Are you less anxious? Are you having less physical problems? Are you less tired? Yeah, I mean, that's how, some of those symptoms of that burnout often look like. So, sleep is important. Being able to get enough sleep and really turn your mind off and being able to rest is really a critical thing. So, Edward, did you want to add anything?
I think, yeah, just a little bit, because it can be kind of a gradual process. It's not like you're gonna be like, oh, I'm a little bit more burnout today. I'm a little bit more burnout today. It really is gradual, and I think that's a really important question to ask. And I think, I can't really, I know I keep bringing this up, but I can't really stress enough the importance of mindfulness and being able to take a step back and kind of get that perspective. I was going to say mental health days are amazing. I've definitely utilized that, that work-life balance. I mean, it's a lot easier said than done, and I'm not trying to undermine that or discount that. But also the importance of social supports, people who can say, hey, I see this in you. A lot of times that's what it takes for me. Somebody like, hey, something's going on. And then, after I'm done being defensive, I'll take a, I'll take a look in and look inside and be like, oh yeah, I'm actually doing, X, Y, and Z. I've been super on edge. I'm easily startled. That's a good red light indicator of that physiological hypervigilance that's so prevalent in compassion fatigue. So that's really kind of all I wanted to say about it. I just wanted to emphasize the mindfulness stuff, like 10 minutes a day. every day can really make a difference. And actually incorporating that into that routine that we talked about, or that I talked about with, that's so important to kind of keep that balance. So that's all I've got about it.
Thank you. So with that, it's almost 1 o'clock, and we thank everyone for joining us. And again, thank you, Edward and Dr. Todaro. And again, this will be posted on the websites and available for later viewing. Please share with others. Please share the link. And there's some great resources out there, and in this presentation. And we're here to support you in any way that we can. Thank you, and take care of yourselves. Thanks.
Thank you. Bye.